Good morning everyone. Today I will present the topic Advanced Trauma Life Support, commonly known as the ATLS. The ATLS is a systemic approach used for the early assessment and the management of the trauma patient. In a trauma care, the time is critical, so the patient is assessed and managed in a structural sequence. This approach ensures that the most critical needs are addressed first. The triage system. It is an international color coding which prioritizes the patient treatment based on their injury severity. There are 4 levels of priority and each of them is given a particular color code. Now the level 1 is considered as an immediate, which represents as a red color. Here the conditions is life-threatening injury and requires immediate interventions. The patient cannot survive without any immediate treatment, but who have a chance of survival. The second, that is delayed, represents with a yellow color. It is also a life-threatening if delayed for several hours. Their condition is stable for the moment and they are not in immediate danger of death. The third represents with a minimal. The color code is green. It's a walking wound and the minor injuries. Need medical care at some points after more critical injury has been treated. And the last one is the expectant, represents with a black color, is a diseased or unsalvageable injuries. The main purpose of the triage is to ensure that the limited medical resources are used first for the patient who have the highest chances of survival with the immediate treatment. The approach to a trauma patient includes 3 major steps. The primary survey, it represents with an immediate assessment and the management of the life-threatening conditions. The golden rule here is to treat what's killing the patients first, followed by the secondary survey. It is a comprehensive head-to-toe examination performed only after the primary survey is complete and the patient's vital functions is stabilized. And the last is the definitive care. It's a specialized medical interventions require manage patients' specific injuries definitively, such as the surgery or the critical care administration. Injuries are diagnosed and treated according to the ABCDE's sequences. What is ABCDE's? A represents airway and C-spine control, B breathing and ventilations, C circulation and the hemorrhage control, D disability and the neurological status, and the E exposure and the environmental control. The A, airway with the cervical spine protection. The airway is the first priority in the trauma care. All the patients get 100% oxygen through the non-breathable mask. But while assessing the airway, we must protect the cervical spine, especially in the patient with the suspected trauma. The neck should be immobilized with the help of Philadelphia collar or the semi-rigid collar before the airway management. This is the Philadelphia collar or the semi-rigid collar. To maintain the airway, some adjunct may also be used, such as the oropharyngeal airway and the nasopharyngeal airway. The oropharyngeal airway, also known as a Goodell's airway, it is used in case of unconscious patient when the gag reflex is absent. The size is measured from the central incisors to the angle of the mouth as shown in the diagram. And another one is the nasopharyngeal airway. It is used in the conscious patient with the intact gag reflex. The size is measured from the nostril to the ear lobes. It is contraindicated in the nasal fracture, naso-orbitoethmoidal fracture, and the basilar skull fracture. The other methods of ventilation, one of the common methods of ventilation is the nasal prong, oxygen mask, and the BMV, that is bag mask ventilation, also known as the ambu bag. The full form of ambu bag is artificial manual breathing unit. Now, the bag mask ventilations is a method of positive pressure ventilations. It delivers 60 ml of tidal volume over 1 second. It can be given in 3 different types. the 3% technique, 2% technique, and single person technique. The 3% technique is where the three different persons maintain the seal, ventilate, and the cricoid pressure separately. In the 2% technique, one person creates a seal and another person ventilates along with the cricoid pressure. And single person technique, the single person maintain the EC seal along with the ventilate as shown in this picture. And the above picture represents the 2% technique. Now there are others advanced airway management devices, that is supraglottic devices, used to rescue the airway for the patient who requires an advanced airway when the intubation is difficult or delayed. The picture 1 represents the laryngeal tube airway. The picture 2 represents the multiluminal esophageal tube, or also known as a combi tube. The picture 3 represents the laryngeal mask airway, which is commonly used. Now the laryngoscope is a device is used to visualize the glottis. It can be of two types, Macintosh blade and the Miller's blade. Now, Mallampati score criteria. Mallampati score or the Mallampati classifications is used to predict the ease of intubation. It is determined by looking at the anatomy of the oral cavity especially. It is based on the visibility of the base of the uvula, fascial pillar, mainly the curvature. So the fascial pillars represents the arch in front and the behind the tonsil. Basically this represents a fascial pillar. The scoring can be done with or without phonations. The higher Mallampati score is associated with a more difficulty in intubation as well as the higher incidence of sleep apnea. In class 1, fauces, fascial pillar, soft palate and the uvula all are visible. In class 2, only the uvula, soft palate and the fauces are visible. No fascial pillar is visible. In class 3, base of the uvula is visible and only the soft palate is visible. And it's class 4. There is no visibility of either of them. Only the hard palate is visible. The definitive airway means a cuff tube is placed below the vocal cord and connected to the oxygen or ventilations. So any method allowing the airway maintenance below the vocal cord is considered as a definitive airway. The indications of the definitive airway is basically the Glasgow Coma Scale with a score less than 8, basically in the comatose patient, high risk of aspirations, hypercarbia, hypoxia and the sustained seizure. In the definitive airway, the ET tube or endotracheal tube. There are various types of ET tubes are showing. The picture 1 is showing the flexometallic tube. The figure 2 represents the PVC tube or the ivory tube. And the third type of ET tube is RAE tube, RAE tube. The RAE represents ring, Adair, Atwin. There are two types of RAE tube, that is North Pole RAE tube and the South Pole RAE tube. The North Pole RAE tube is indicated in case of mandibular fracture and the South Pole RAE tube is indicated in case of nasal fracture, nasoorbital fracture or any case, any types of midface fracture. If the airway cannot be maintained by basic method, the surgical approach should be considered. The surgical approach indicated in case of failed intubation, obstructive airway, glottic edema, laryngeal fracture, severe bleeding, etc. There are two types of surgical airway approach, that is the cricothyrotomy and the tracheostomy. The cricothyrotomy is one of the easiest and the fastest emergency procedure. The cricothyroid membrane is punctured with the help of 12 to 14 gauge of needle in case of adult, or by the surgical interventions with the help of incisions on the membrane. This picture represents the cricothyrotomy. At first, the slit vertical skin incision is given. After that, the horizontal incision through the cricoid membrane is also placed. Now, insert a speculum and turn it 90° to dilute the incision. A small diameter of the ET tube is then inserted to maintain the airway temporarily. A cricothyrotomy is usually preferred as a last resort when the control of the airway is usually failed. This technique is considered as easier and fastest than the tracheostomy. But always remember, the cricothyrotomy is only a temporary airway in the life saving situation. It is not suitable for prolonged ventilation. On the other hand, the tracheostomy is also used as a last resort due to the time and the complications. The tracheostomy is referred to the window. The tracheostomy refers to the window made in the anterior wall of the trachea just below the larynx. Provides an alternative pathway to bypass the upper passage. Now comes to the complications. Both this surgical technique or approach comes with its own complications. The most common complications are hemorrhage. It is basically due to the anterior jugular vein and the superior thyroid artery. The other complications are subcutaneous emphysema, pneumothorax, tracheal stenosis, etc. The second approach in the primary survey, the B, stands for breathing and ventilations. To ensure the adequate gas exchange, the ventilations required adequate functions of the lungs, chest wall, diaphragm to ensure the oxygenation and the carbon dioxide eliminations. The emergency ventilations is critically needed in tension pneumothorax, massive hemothorax, open pneumothorax, and the cardiac tamponade. Most clinical problems in the breathing can be treated with a relatively simple measurements such as ET tube or endotracheal intubation, mechanical ventilations, etc. Now the C, the circulation and the hemorrhage control. The circulation is a third priority in the primary survey. The circulatory problem in the patients is usually caused by the hemorrhage. The first action should be taken that to stop the bleeding. Scientists have divided 4 different categories along with its parameter to classify the hemorrhage and its management. Now, class 1 represents when the blood loss is less than 15%, class 2 is 15 to 30%, class 3 considered as a moderate when the blood loss is 31 to 40%, and severe, that is class 4, when the blood loss is 40%. In case of class 1, the blood pressure is normal, Pulse pressure is also normal and the urine output is also normal. So the management is basically done through monitoring. The class 2, the mild hemorrhagic cases, the blood pressure can either be normal or slightly increases. The pulse pressure is also similar. Either it can be normal or slightly decreases. The urine output here is decreases. That is also known as a oliguria. So the management here can be done with the help of replacement crystalloids. The moderate class 3, here also blood pressure is slightly increases more than the mild class 2, and pulse pressure is also slightly more decreases than the class 2, and urine output here is also same oliguria, and the management is also considered here, that is a blood transfusion. Now comes to the severe one, where the blood loss is more than 40%. Here the blood pressure is rise severely and the pulse pressure is also decreases severely. Here the urine output is so less that it's considered as an anuria. Here the management can only be done by massive blood transfusion. So the primary goal is to stop the bleeding and resuscitate the replacement of the lost volume. After the stoppage of the bleeding, the blood pressure and the heart rate is measured. Two IV lines are started and the blood is obtained from laboratory investigations. Resuscitation means the replacement of the lost volume. It can be done with the help of crystalloids like Ringal lactate or Hartmann solutions, or by adding a packed RBC. The 1 unit of the packed RBC increases the hematocrit by 3%. Sometimes the dextran can also acts as a best plasma expander. After the circulation and the hemorrhage control, now comes the D, that stands for disability. The disability should be assessed as a fourth priority, and this includes the assessment of the neurological status. The Glasgow Coma Scale is used to evaluate the severity of the head injury. This score is arrived at by scoring the eye opening, motor response, and the verbal response of the patient. The patient who opens their eyes spontaneously, obey the command, and are normal oriented considered as a maximum score of 15. On the other hand, if none of the three criteria are present there, then it is considered with a minimum score of 3, that is more severe. Generally, less than 8 is considered as a severe, 9 to 13 is considered as a moderate, and more than 13 is considered as a mild. The last approach, E, represents, that is exposure. Represents the hypothermia, burns, possible exposure to the chemical or the radioactive substances, and should be evaluated. Only after the primary survey is complete, the life-threatening problems have been managed. Now the secondary survey can begin. This is a detailed head-to-toe examination. And useful history format is ample. That is, the A stands for allergy, medication, past medical history and pregnancy, last meal, events and environment of the related injury. The secondary survey includes examinations of the head, neck, chest, abdominal pain, pelvis, back, and neurological system. Investigations may include X-rays, CT scan, blood tests, and other imaging depending on the patient's condition. By following this systemic approach, the healthcare providers can act quickly, reduces and missed injuries, and improves the patient survival. So that's it for today, guys. I hope you like this video. Do consider subscribing the channel and like the video for more such interesting content.